Good morning, how are you? Wish you are fine. I want to speak about the Asian rhinoplasty and about anatomy. The anatomical structures comprising the nose can be considered in groups by anatomical layers. Surgical dissection between these structural planes is critical to preserving the structures contained within each layer. The external layer or soft tissue covering is composed of the skin, subcutaneous tissue, superficial muscular aponeurosis system, SMAS, and supporting vasculature with contribution from the dorsal nasal lateral, nasal, angular, and columnar arteries. Deep to these layers in the nasal skeleton of bone and cartilage, the bony dorsum, which makes up the superior third of the nose, is comprised of paired nasal bones attached to the frontal processes of the maxillary bones laterally and the nasal process of the frontal bones superiorly. The inferior two-thirds of the nasal skeleton is cartilaginous, including the septum, paired upper lateral, lower lateral, and sesamoid cartilages. The quadrangular cartilaginous septum connects with the anterior bony skeleton through the perpendicular plate of the ethmoid bone superiorly, the vomer bone posteriorly, and the maxillary crest inferiorly, supporting the dorsum lateral to the septum and the upper lateral cartilage, which attach to the undersurface of the nasal bone superiorly, the piriform aperture laterally, and are continuous with the cartilaginous quadrangular septum medially. The inferior edge of the upper lateral cartilage join the lower lateral cartilage in the scroll area caudally. The lower lateral cartilages are paired arches that join medially by fibrous connections with the columella connections also exist between the medial crura and caudal cartilaginous septum. The final layer, the internal lining, is composed of a vascular rich mucosa and perichondrium or periosteum overlying the cartilaginous or bony skeleton respectively. Consideration of the entire face must not be ignored when evaluating a patient for rhinoplasty. The nose is the central feature of the face and thus should be reshaped in harmony with the overall facial dimensions and contours. The anatomic aesthetic subunits of the nose include the median structure, dorsum tip, and columella, and paired lateral structures, nasal side walls, ala, and soft triangle faces. In contrast to Caucasians, Asians typically don't have a well-demarcated soft tissue triangle or nasal seal, and the lower dorsal profile tends to blend the side wall into the cheek. Other differences include a lower lying radix, greater alar width, and more extreme nasolabial angles. The nasolabial angles is more obtuse in Asian females, but more acute in Asian males compared to Caucasians. The overall structural support in the Asian nose is weaker when compared to Caucasians. The lower lateral cartilages are weaker, and the quadrangular cartilage is both thinner and smaller. The septal cartilage alone, as a source for augmentation grafting material, is typically inadequate. In general, I wish that you will see all of the video and watch how we can extract the cartilage to reshape the nose and give good result give satisfaction to the patient. The most important thing that some of the patients or some of the customers may prefer to have cartilage grafts more than other alloplastic grafts like silicone or medpore. Or according to me, I prefer to use the cartilage more than the other. It is difficult more. It takes more time, okay, and needs a time for healing. I may give another and may make another videos about that. If you like the video, please make like, share, subscribe to my YouTube channel.